Good evening. When the health risk assessment tool, VH health risk assessment tool, is going to be made available to the veterans, it will put a very powerful tool in their hands in that they can take a comprehensive assessment of their health risks based on clinically validated data in online format. We'll be able to, at the conclusion, simulate health improvement measures to reduce their risks, and then be able to share that with their personal health care provider. I mean, just a very powerful trifecta here that is going to be put in the hands of the veterans. The sponsor of the HRA is the National Center for Health Promotion and Disease Prevention, NCP. And we're about 1 year into the project, and over the last 11 months, they have been very busy in collaboration with Aquilent to customize the COTS application product to meet clinical guidelines that are relevant for the VA population. So a huge effort has gone into this. We're also at a point now where this application has been customized with a front-end interface and has been built from the ground up to be 508 compliant or accessible with persons with disabilities. We're about 1.5 years away from this application going into production, so I just wanted to kind of sneak ahead and show you what the next year will entail. So the next year will be all about the integration with VA's My Healthy Vet portal, and essentially it will pre-populate demographic data, certain health stats, making it easier for the vet to get into the system. So if they're authenticated through NHV, it'll automatically provide that information. Also, it will be more accurate because it will pull from the master patient record. In the last half year, so September 2013 through the culmination of a national release launch in March, it will then integrate with the CPRS system, which essentially sends a web service from the HRA processed through NHV and is then securely transmitted to the healthcare provider. But what I want to do now is kind of take you forward to March 2014 to kind of give you a highlight of what this application will look like and do. And I'm going to have Sharon, our fictitious vet, help us here, and she is a 35-year-old vet, and she's taking the assessment for the first time. Sharon is presented with some screens related to her family history, health habits, and health questions in general about her personal health. And depending on her response pattern, she'll be receiving additional questions, answers, conclusions that others may not receive just because of the way she responds and the condition of her health. She'll go through these screens, and then she'll finally arrive at a point where she can review all of her answers. She can then go in and make changes, and any changes she makes, she may trigger some additional answers questions that have to be answered. But then at the conclusion, I think now Sharon says, you know what, I'm good with this, I'm going to mark this as complete. And then she's presented with, this is quite compelling, with the health risk summary report. Most notable on there is the health age. Now remember, Sharon's 35 years old. She has a health age of a 43-year-old, or expressed in a different way, of the life expectancy of a 43-year-old. But positive feedback, 11 years can be rolled back by basically simulating some health improvement measures. She can check one, multiple, all of them off, depending on what her goals are, and those will be reflected in a reduction of the risk bars, represented in orange. The blue bars are hereditary, cannot be changed. But she has a perfect picture here to set goals. And by the way, not shown here that once she simulates these behaviors, the health age will roll back to a maximum of 11 years back. And she also has kind of a general view of what she's doing well, not so well, and really what needs some improvement. Very powerful feedback. And this report then can be shared electronically eventually with their healthcare provider. So that kind of gives you the 30,000-foot view, and I look forward to answering any questions you may have. Thank you very much.